Hi there. I'd like to welcome you to this live stream of the COVID-19 Disaster Workers Fight Back Forum. Sue Bull is chairing it. I'm going to pass you over. The meeting's just started. I'm going to pass you over to her just now.
We're the people that have been doing all the work, and we're all the people that have been suffering. But meanwhile, all sorts of things have been going on. And tonight we're going to bring you two speakers from health unions. Andrew Hewitt, who's the Assistant Secretary of the Victorian Allied Health Professionals Association, and Paul Gilbert, who's also an Assistant Secretary, and he's from the ANMF, the Australian Nursing and Midwifery Federation. Both of them are officials in Victoria. And our third speaker is Adele Welsh. She is from the Socialist Alliance. She's currently the President of Geelong Trades Hall and an ASU, an Australian Services Union delegate. So we're hoping to have a discussion about what's going on at the moment. I suppose you didn't really, our two health representatives are going to tell us more of the nitty-gritty of what's really going on in the health industry. As if you didn't already know that there's so many issues, but we're going to get an insider's view. And you'll be interested to note that there's a few nurses in our audience as well. And there's a few MUA members, construction workers and so on, because every worker has been impacted by the pandemic. In fact, it's not so difficult to begin to realise just how hard it's been for so many people. You'll all know that since Omicron ended up as a major variant in Australia, that more people have died in the last 6 months, 6 weeks. So half as many people in the last 6 weeks, 2,000 people have died. And yet there's been 4,500 people dying in Australia. So in 6 weeks, we've had half as many people die as we've had in 2 years. So that's why we've called it a crisis. And that's why there's so much debate going on about what's really happening in workplaces. Of course, it's also normalised this idea that it's okay, you know, it's only the elderly dying, and that's been the whole issue right throughout, actually. But we've also seen that health services union workers, who are the aged care workers, are actually asking for a 25% wage increase because they are leaving in droves through being underpaid and massively overworked. So they're the sort of issues that we want to look tonight and so much more. We're hoping in discussion that we'll have the first part of discussion, which will be a few questions and clarifications. And the second half, we want to look more at, well, where do we go from here? What are we going to do? How do we fight back? What are some of the strategies and what are some of the ideas? At the moment, there's not a lot of ideas about how workers can begin to fight back through this period, because remember, the other side of it that's been shown throughout this is that there is a genuine worker shortage in Australia. Once overseas workers were sent back home, we've seen that lots of industries are extremely short of workers. We also know that those workers were seriously underpaid and exploited. How are we going to address issues like that in this coming period? How are we going to shore up the health system and all the other services areas? Anyway, I'm not going to answer all of those questions because I hope our three speakers tonight will go part of the way towards that. So what we're going to do is we're going to have Andrew Hewitt from VAHPA first. So Andrew, really great to see you online. Welcome, and over to you.
Hi, Sue, and thanks for the opportunity to speak. And Paul's probably regretting now that he missed the turn of the dice, because we're probably going to overlap in terms of what we say, because we've been in a lot of the same rooms and a lot of the same meetings, and because we're both in health unions, we've been experiencing a lot of the same problems throughout the pandemic. But what I wanted to do first was just give a bit of an overview of where we're at and sort of how we got there and where we're going to from here. So it's important to remember that Australia was very poorly prepared, and probably the world was as well, pretty poorly prepared for the pandemic when it hit. And we had, at the outset, fairly inadequate protections, and they were based on what the WHO was the guidance from WHO, and the Commonwealth was setting the parameters based on what WHO was saying. And then the states were applying their own level of interpretation of that as well. And if you think back to the start of the pandemic, we weren't wearing masks, we didn't have vaccines, and sadly, it was being treated as a virus that was spread mainly through surface contact spread, whereas we know now very well that it's spread. The majority of the spread comes through aerosols, so it's through the air, through the virus circulating through the air. And unfortunately, it took quite some time for that to be recognised. And if you think back, it wasn't actually until early July in 2020 before Melbourne introduced its first mask mandate. And to put that in context, that means that there were healthcare workers in hospitals and healthcare settings and the aged care facilities who didn't have access to masks up until that stage, because it was really only those people who were working in the EDs or the ICUs, and there weren't a lot of COVID dedicated wards then, but they were starting to develop, who were getting access to proper PPE. So the rest of the healthcare sector weren't getting it. And it was really only once it became clear that there needed to be a mask mandate across the public sector that we managed to get those protections in the health settings. Now, that's not for lack of the unions trying. We were calling for better protections right from the start. And it was very clear that part of the problem was that they just didn't have enough of the PPE that we needed. And so they almost set the requirements for the PPE based on the availability rather than on the level of protection that was required. And it really wasn't until October in 2020 that Victoria was the first jurisdiction in Australia to formally recognise that the spread of the virus was through airborne spread. And that really only came about, again, through pressure applied by the unions, largely through what they established healthcare worker task force. So in Victoria, there's a healthcare worker prevention and infection prevention and wellbeing task force that was set up as a response to the devastation of the healthcare worker sector during wave 2 in 2020. But the unions had representation on that task force, and we were applying pressure to get formal recognition of airborne spread. And then we finally achieved that, and then we finally achieved proper respiratory protection, and they started doing fit testing so that to make sure that the respirators, the masks were well fitted and appropriate, and there was education around that. But up until that's late 2020, so we were well into the pandemic before that was happening, and we were meeting on a regular basis with the government and the Department of Health and the PPE task force, and calling out from these protections from early on, and it was very clear that they just didn't have the resources to do that. And even once they had the resources, there was still a reluctance. And my personal belief is that some of that was about the expense. They could just see they were just hemorrhaging money in the pandemic response. And it was pretty clear that they, even between the first wave of the pandemic and the second wave of the pandemic, and then again after wave 2 coming into 2021, we were saying, are you stockpiling? And it took some time for them to realise that this was going to keep happening, and that they had to actually just commit and get the supplies in place. But what happened in 2020? We ended up with 4,171 healthcare workers who were infected. Now, up to 80% of those infections occurred at work, and that was a disaster for the workforce. And for all those healthcare workers that were infected, there were thousands or tens of thousands more who were furloughed as a consequence of being close contacts. And that just devastated the workforce. And that made it very clear that they couldn't continue as business as usual. And so, there were changes coming out of that. Now we see that the furlough guidance is reduced from 14 days down to 7 days, and the definitions of close contacts have all changed. And so there's been all these changes, but all of that's been driven by the lack of workers, the lack of availability of a workforce, and workforces that are burning out. So on the back of over 4,000 getting infected in 2020, we had over 5,000 infected, nearly 6,000 infected in 2021. Now, we don't have the same level of certainty about how many were infected at work and how many were infected in the community there, because by the end of 2021, we know that the system was being overwhelmed, and they weren't being able to test and trace and identify, and there wasn't that level of certainty about where they were happening. But from our point of view, there was still a huge component in the work environment. But despite the fact that we were getting better protections, it's very clear that the workplaces weren't safe enough, and that the levels of protections weren't broad enough, or the access to the PPE weren't good enough. The workforce shortages weren't just about the pandemic. It was really a case of exposing long-term vulnerabilities in the system, and the health system in particular. And as Sue referenced, this is not just about a workforce shortage in health; it's a workforce shortage across all sectors. But from our perspective in health, it was a case of running a system too lean for too long. When the pandemic came along, it just highlighted that we were extremely vulnerable in terms of our workforce. And once the tap in terms of the ability to bring in overseas workers was turned off, or even to move around workers around Australia, once that stopped, suddenly we didn't have enough workforce to keep the system running at the same level as what they required. Despite that, a lot of the health unions have been through bargaining through this period, and we're still not seeing a reflection of that workforce shortage in the outcomes in terms of what we need in terms of the bargaining outcomes. So, the power really should be with the workers at the moment because there's such a workforce shortage. And so we should be able to use that to leverage better outcomes. But the government is still resistive on a lot of that area. So what have we done well over that period? Well, I talked about the unions, Victorian health unions being involved. The Victorian health unions have actually been very collaborative, and we've managed to get together on a regular basis. We've managed to caucus about specific issues. We've put in letters to the government. We've put in submissions to the government on a collaborative basis, and that's given us a significant amount of clout and added to the ability for us to actually influence what's going on. Despite that, we've still been, to some degree, held at arm's length, and there's still been a breakdown in terms of the outcomes. And so while we've been able to influence them, they've never ever gone to the level that we've actually needed. The lines of communication have been much better than they had been prior to the pandemic, in terms of we've had much better access to employers and to the government. But again, it doesn't necessarily translate to the better outcomes, and sometimes it can be very one-sided in terms of the outcomes. Communication has been highlighted as critical through the pandemic in terms of not just the communication we're talking about with government employers, but through to the workers. The workers that desperately need to know what's going on. They need to know good, clear information, and they need to know that they can trust that information. And the unions have been largely, in Victoria especially, a resource for that, and hopefully that's helped benefit the workers. Through those engagements with the government, we've managed to, as I said, improve the PPE throughout the pandemic. We've managed to get better leave entitlements, such as paid special leave when workers have been off isolating, either infected or as close contacts. We've been able to get leave entitlements if the healthcare workers have had a reaction to their vaccine. So vaccines have been a requirement, as we know now, in the workplace. So we've managed to achieve some better outcomes, but there's still a lot that we could do better with, and the government could do better with providing. We've managed to get some extra resources in some areas, but again, as I said, we're still a long way short of that. And we've been able to enforce some employer accountabilities, and that's been really important. So, union collaboration, I think, coming out of this is something that we need to really maintain. So what's gone badly? Like, as I said from the start, the preparation was terrible. We were behind from the start, and we've been trying to catch up ever since. And even when we've had periods of effectively quiet times between the waves, instead of keeping the foot on the gas and pushing forward in terms of improving the protections and improving the situations in the workplaces, there's been a sense of, we got through that one, and almost a sense of relief, and then we've allowed ourselves to be on the back foot when the next waves hit. So preparation, we can't assume that at any stage that we're out of this. We have to just keep keep pushing forward. We've done it particularly badly, and it's been exposed, and there's been royal commissions, and they've highlighted the failures. But the aged care disability sector have been absolutely devastated by the pandemic. So people in vulnerable situations have been suffering the greatest throughout this process, and that's been a huge failing in terms of the pandemic response, and something that we have to do better. And even in terms of the aged care sector, we had in Victoria in 2020 we had I think it was over 600 tragic deaths in aged care centres, predominantly all in the federal under the federal jurisdiction. Yet here we are again, 18 months later, and we're still having huge outbreaks in aged care settings. And it's a case of, well, did we not learn anything from what's gone on before, and have we not improved the situation from what was going on before? Community care, people in the community that have been relying in the past on the care that comes to them, that's fallen down in a lot of areas. So there are a lot of people who have not been getting the care that they need or that they would normally get, and that's going to be a huge problem and a huge burden going forward. The devolved nature of the healthcare setting in Victoria, for those who are unaware, Victorian hospitals are basically run as their own little independent company, and each one of them is effectively just that, a company. And as a consequence, the government doesn't have the direct line of control that that they should have. And as a consequence, that's meant that there's over 80 different health services throughout Victoria. That means at any given time we can have 80 different interpretations or 80 different applications of whatever it is that the government's trying to do, and that's been a huge problem for us. That's led to things like consultation breakdown, hospitals implementing changes without consultation, government implementing changes without consultation. That's something that that really leads to a lot of fear and anxiety in the workforce, but it can also lead to bad outcomes, because if there's not the adequate consultation, we know there's not the adequate risk assessment, then we know that there's not the adequate mitigations put in place. And so that's something that's been done pretty badly. Elective surgery, that's something that's really suffered as a consequence of the legitimate need to focus the energy on the acute COVID response. But again, it's a sign of a system that was, that's been at its limit for far too long, and as a consequence, there's a huge section of the health sector that's been left behind. And you couldn't have this discussion without talking about the private versus the public health system. And the fact that we've got this split system has led to a lot of ongoing problems, and that can be highlighted through the pathology system, where a large part of Victorian pathology has been privatised. Even the pathology that services the major public hospitals in some situations is a privatised service. And once the system came under extreme pressure, that started to fail, and the testing started to fail us. And so that's something that needs to be looked at going forward. When I was preparing to talk to you tonight, I found an article which I can't help but want to share some of with you, because it just highlights the fact that while all this is going on and this workforce is being decimated, there are those who are actually benefiting out of this misery. And Oxfam published this article about a month ago, and it's all about the billionaires, how they've managed to profit out of the pandemic. There's a new billionaire minted every 26 hours, as inequality contributes to the death of one person every 4 seconds. And the world's 10 richest men more than doubled their fortunes from 700 billion to 1.5 trillion at a rate of $15,000 per second, or $1.3 billion a day, during the first 2 years of a pandemic that has seen the income of 99% of humanity fall, and over 160 million more people forced into poverty. That just brings it into harsh focus that the workers who have been carrying the can are coming out of this worse off than those who basically carry the wealth of not just of the country but of the world. And that's the inequality that has allowed to create and accentuate is, has to be looked at. In terms of what we can do, in terms of on a worker level and on a local level, we've got to be looking at the policies in terms of how to improve our protections and how to improve the well-being of the workers. We've got to have basically what we call a vaccine plus policy. So we can't just rely on the vaccines. The vaccines are critically important, but we can't just rely on them and the ongoing boosters as they, hopefully improve the vaccines with each different variant. We need to clean the air. And the best way to think about this is to think of the disease of cholera. Cholera is a waterborne virus that used to devastate communities. And we fixed that by sanitizing the water. We have clean drinking water now. So we don't have cholera unless it's in a situation where there's some sort of natural disaster that impacts on the water sources. We need to think the same way with the air. We need to be cleaning. We need clean air to breathe. So to do that, we need to bring in more outside air into the buildings. We need better ventilation. We need filters, HEPA filters in the rooms, in indoor spaces to scrub, to clean the air. And wherever possible, we need to be meeting or working or activities that are outdoors, because that's a much safer environment. We need better masks. We need the P2 or N95 masks wherever possible in environments where we can't get clean air and when we're exposed and at risk. And that goes to, majority of workplaces. If you're in close working environment in an indoor space, then, you should have access to better masks. We need better supports. We need to see paid leave for people who are sick or who have to isolate. And that's, fundamental. And the public health system has managed to achieve that, but that's a very, very small part of the workforce, and we need to see those people who need it most have access to better supports and better leave. We need free testing on an ongoing basis. We need vaccine equity, and not just within our community, but around the world, to stop the continual spread of the virus, which is going to lead to more and more variants. And from our point of view, we need to see safe workplaces. The unions have a really key role in this to implement these changes and to ensure that we hold employers accountable and governments accountable and ensure that we've got the safest workplaces that we can through these mechanisms. I think that probably, I'm not sure how long I've been going for, Sue, but I think that's probably plenty for me, and I'll hand back to you. Thank you.
Thanks, Andrew. That was wonderful, actually, because you ended with a whole series of things that we need to do, and of course that's really what tonight's about. None of us would have any disagreement as to what to do with what you've just said. It's the how do we do it part of it. But our next speaker is Paul Gilbert, and Paul's going to talk about it. He's from the ANMF, the Assistant Secretary, and he's looking at it, of course, from right inside the hospitals as well, like Andrew's union has been, from a nursing perspective. So welcome, Paul, and over to you.
Just making sure I wasn't on mute, you know how it is. I'm going to start off, thank you, Sue. I'm going to start off by saying, because we're always very defensive of our own unions, I think all of us are, we've actually got more aged care workers in our union than any other union in Victoria, including personal care workers, and we're an applicant in both of those wage cases in the Fair Work Commission. Just for clarity, I thought I'd add that in. I think Andrew would appreciate the conundrum that we've evolved into tonight. And I'll just give you this little piece of information if you're not aware of it. Andrew and I were in a meeting yesterday afternoon where, due to, it's been a horrendous 4 weeks in the health system. I'll come to that in a minute. But I don't think getting vaccinated was uppermost in people's minds for the third vaccination. And it was clear that there was a substantial proportion of healthcare workers who were not going to be vaccinated in time for the 12th of February cut-off date. So we were in a meeting yesterday where they announced a 4-week extension of that. We weren't supposed to tell anyone because it would ultimately be announced, and that's the nature of being involved in these things. When it was announced, which may have even been before the meeting, as it turns out, you only got the extension if you had a booking, evidence of a booking before tomorrow. Evidence of a booking between now and the 12th of March, but you had to provide that evidence between today and tomorrow. It's really super weird. I'd agree with Andrew that we probably had more consultation or at least conversation than we've ever had during the pandemic with government, with the department, with each other. But what's occurred in the last couple of days is an extraordinary turn in that, where something else is happening. There are other people exercising influence without recognising the consequences of that decision. And that announcement last night and into today is a classic example of that, where someone has stupidly thought that 30,000 healthcare workers could book a vaccination today, report it to their employer, and that their employer make a verifiable record of that in one day. Otherwise, they can't come to work tomorrow. That's been a real disappointment compared, I think, to what we have experienced in terms of consultation right up until that last couple of days. So we don't know what the cause of that is, but that's an example of how bad it is right now, or how silly some of these things can be. That's going to be a real confrontation moment for Andrew's members, ours, and everyone else who works in the health system. And I think the police have already come out and said the same, as have the AMBOs. Really extraordinary. This has been an unprecedented event, a once in a century event. You've got to go back to the Spanish flu, or Spanish wasn't even their flu, but that doesn't matter, to the tuberculosis hospitals. You've got to go all the way back to those kind of things to find a comparable moment. Should we have known it was going to happen? Well, a pandemic is inevitable. When will it happen? That's the thing nobody knows. For more than 30 years, we've known that amongst our membership, the biggest single issue that gives them respect at work isn't money. I'm not going to say money's not important, it is. It's actually having a manageable workload that enables you to do what you've been educated to do. You get job satisfaction from that, and you deserve to be paid well for that. So our focus has been, sometimes at the expense of wages, our focus for a very long time has been on improving, securing, mandating and improving staffing levels. In 2019, we had our first decent wage increase for a very long time for our public sector members. And that was in no small part because our ratios, instead of having to bargain for them every 4 years, were now in legislation. So we were free to bargain without concern that we would have our staffing levels compromised by a good wage increase. And that's something that I'm sure a lot of unions have experienced in the aged care sector, particularly, is that every time you improve the wages by 2%, you decrease the staffing levels by 2%. And it's a creature or nature of a profit-driven system. That is the reaction. They will keep their 14% return on investment, and they'll take the cost out of staffing. To say that the impact of COVID has been extraordinary, I don't think you could. It's such an understatement, particularly since Omicron. Now, we thought it was bad, in December, and then, as Andrew said, we had this little moment of reflection where it paused in a real sense, and then came back with an absolute vengeance, a vengeance that I don't think the community fully recognised, and even now doesn't fully recognise. We, in order to staff the wards that had thousands and thousands of COVID positive patients in them who were in respiratory distress, the only way we could come close to staffing those was to redeploy people from theatres and surgical wards. The consequence of that is you, and forgive my French, but you piss off the theatre nurses to begin with, and I hear about that very often. But you also have to pause elective surgery, and that is not welcomed by us, by anyone. But when you've got a conundrum like we had, it was one of the few tools we had to get us close to having some staff for those wards. If you think back, a little over 2 weeks ago, we had 6,400 healthcare workers in Victoria in isolation on one day alone. 6,400 in furlough. And there's a word that wasn't used out of America in my experience until the last 2 years. So 6,400 in one day. That's like 6, 7, 8% of the workforce on furlough for a week, peaking at 6,400. At the same time, we had over 3,000 people admitted for COVID treatment in our health system. So you had a perfect storm, a reduction in the already fragile levels of available staff and a massive increase in patients requiring care. It was and is and remains an extraordinarily painful moment in our history. Some of the wards we've got 50% less nurses on than we had on those wards before COVID. That includes 21 of our major emergency departments. So not only have we got a crisis in terms of the severity of the people who are turning up for care, we've got half the number of nurses that we would have had beforehand caring for them. That has meant that we've had to bring in students, we've had to bring in some of Andrew's members who wouldn't ordinarily have be expected to do nursing work, students of his professions, retired people. I think they're just about taking anyone. And when our members, as I said before, our members' number one issue in terms of the respect for themselves and what they do is workload. And workload is numbers, and numbers are shot. These things have to stop, and have to stop very quickly, because it has a cumulative effect on our members' mental well-being, and that's creating distress, anger, trauma, resignations from the system, all things that will take a very long time to fix. Our private acutes have picked up a hell of a lot of the public health sector work, not the COVID work so much. I think we had at the peak of the COVID hospitalisation, they had about maybe 5%, if that, of the number of patients with COVID in the public sector. But it was a resource of sorts that could be called upon, although they were, there were some pretty grumpy surgeons out there, as you've no doubt heard in the media, who were very happy to say, my hospital has empty beds, why can't I operate? Without any perception or understanding that those beds usually have nurses attached to them. When they go home, that's what happens. Very distressing, divisive, ugly behaviour by a very small portion of people. In aged care, as Andrew said, it is the worst. It is the worst thing. I got an email from a member 2 days ago, and I'm embarrassed that I'm sitting on it because I want to fact check it. I can't believe that it can be 100% true. If I had tried to make up the worst nightmare story, I couldn't have written a story as bad as that member wrote. It is distressing, and I gave evidence to the Royal Commission. I know, we've been involved in aged care for a long time. We know what's needed. We know what's wrong. We know what has to be done. As yet, we don't have commitments from either the Labor or Liberal Party to do those things. And we had a moment what day we're up to, Friday, it would have been about mid this week, where we had a nursing home where there was one carer for 170 residents. How can that possibly work? Anyway, PPE is an interesting thing. Andrew spoke a lot about PPE. I think one of the peculiar things about the PPE environment was that the unions were the experts on PPE, not anyone else. We had to research and invent the rules that became the rules. That's almost embarrassing, isn't it? But it's true. And you know, the concept of having an N95 fit tested mask was unheard of in health a year ago. Not unheard of in other industries, but unheard of in health. That was something that had to be created and agitated for by the health unions. I think the worst thing we've seen in this is a growth in that old term management prerogative. Some employers have lovingly embraced the crisis to treat their staff in the worst way I have seen in 30 years. It's not universal, but it's true of probably at least 3 of our 7 biggest employers. It's like they've been let off their leash and this is their chance for payback. And what that does to members, of course, is make them angry. So they go from frustrated to angry. And I know your focus tonight is on what can we do to avoid this in the future. At the moment, we're still getting through the present. I'd love to focus on the future. I know a few things I wouldn't do in the future. I wouldn't close our only infectious diseases hospital. That'd be a dumb idea. But thinking about that now, you would need a 2,000 bed hospital with 200 ICU beds to cope with the Omicron equivalent of January, February this year. Can you imagine a government allowing a fully staffed 2,000 bed hospital with a 200 bed ICU to sit there when there wasn't a pandemic happening? I'd be very surprised that that occurred, but we do need to build a buffer into the system. I don't yet know how. You've got to remember it takes years to train a nurse and to enable them to work as a nurse after they get out of university or TAFE. It's not something that they can do at the time. One of the things that we did early in the piece was bring in students. We know that we knew that our nursing free students were doing 3 or 4 days a week in university and then working in Kentucky Fried or a hotel somewhere for income on the other days. And what we wanted to do was to say, well, why can't they work in the health system on those other days so that they get a bit of a chance to, be supernumerary, get a feel for the system, put some of their knowledge into practice. I'm very pleased to say that that has been belatedly embraced by employers, and I think that will be a feature that will continue into the future. Whatever we do, we have to recognise that we are not and don't want to be a San Francisco dock worker waiting for their call. We don't have a queue of workers lined up. They aren't there. No union wants a queue of workers lined up, obviously, but we don't. We just don't have them. It will improve with border opening, but that is robbing Peter to pay Paul too. Acute care at home has improved dramatically by necessity because they couldn't allow people to come to emergency departments. So we've learned a bit. That's better, but we are moving nurses like deck chairs on the Titanic. There's only so many to go around. As Andrew said, we need to reduce the number of health services. Having 81 little empires, all interpreting the same piece of information differently, has probably been, from a union point of view, the most frustrating thing of this whole adventure. Right. I know Andrew's having a lovely cup of tea, or I'm having a beer. I feel awkward. My last comment, I think, is, should it be up to the unions to be the leader in PPE? I know we are, but should we be? And I think that's something that ought to be the government's responsibility, to be funding and investing in that rather than the unions. But it has been extraordinary that we've come so far in a relatively short time on the PPE front, I'd have to say. So I'll pause there and see if I can't recover my COVID-infected throat, which isn't really COVID-infected, but it sounds like.
Thank you so much, Paul. I knew you'd tell some horror stories, and of course there are plenty that are coming out of the health system at the moment, and lots of food for thought. Of course, we do want to talk about future solutions, but we have to talk about present solutions too, so we're definitely not ruling those out. Our final speaker for the panel is Adele Welsh. Adele is a social worker. She's currently the president of Geelong Trades Hall, and she's also speaking on behalf of Socialist Alliance. So welcome, Adele.
Thanks, Sue. Thanks for having me to speak, comrades. I'd like to acknowledge the traditional owners of the land that I'm on tonight, the Wurundjeri people, and pay my respects to their elders, past, present and emerging. I'd also like to extend that respect to any Aboriginal people here with us tonight. This land was stolen, never ceded. It always was, and it always will be, Aboriginal land. Before I start, comrades, I'd just like to extend my solidarity to the families and friends of the nearly 6 million people around the world who've lost their lives during this pandemic. That figure includes about 4,500 Australian people who have died with or from COVID during this pandemic. And devastatingly, as Sue's already mentioned, more than 2,000 Australians have died from or with COVID in January and February alone in 2022. No matter how governments and bosses like to dress it up, letting it rip has caused untold harm on our families, our workplaces, and our communities. And shame on every single government in Australia and around the world who've put profit-driven neoliberal capitalism before the health, the safety, and the lives of working people around the world. And further shame on every government of every wealthy nation who's stood by and let the virus rip in poor and developing countries and nations and haven't taken steps to end vaccine apartheid by giving the poorer countries free vaccines and helping them out with medical support. Letting it rip just lets the virus spread and mutate. And that means more waves, more cases, and more deaths. Here in Australia, our experience has been a little bit different to lots of other countries. Until pretty recently, closed borders and strict lockdowns were fairly successful in keeping our infection rate and our death rate lower than lots of other countries in the world. But when you see Scott Morrison and Daniel Andrews and all those government people standing up, bragging about how well Australia's done, what they're not saying is that most COVID deaths in Australia have been mostly preventable. If we had proper, purpose-built vaccine quarantine facilities, if we had a well-funded health system and a robust public service, and if we'd had an efficient rollout of vaccines and boosters, if we had the PPE that we need and a work system that isn't casualised and low paid, if we had state-run aged care facilities, there's every possibility that Australia's death rate could have been much, much lower. I'm the fourth speaker tonight to talk about aged care, and I know Paul's mentioned that it's quite a distressing topic, and it is really distressing. Aged care residents, people living in aged care homes, have been left starving, malnourished, sitting in urine and faeces, with wounds untended, unshowered, sick and dying. And they've carried an overwhelmingly unacceptably high COVID death burden since the start of the pandemic. In Victoria's second wave, private for-profit aged care facilities had the biggest outbreaks and the most deaths. Socialist Alliance knows that public health belongs in public hands, and we know that for a good reason. Because during our second wave, state-run aged care facilities in Victoria had hardly any COVID outbreaks and very few deaths. And we know that if vaccines and boosters were rolled out efficiently and on time, far fewer older people would have died during the Omicron wave. And if aged care nurses had proper PPE, and if they were paid a living wage so that they didn't have to work across numerous homes, and if they had RAT tests, we could have saved more lives. 1 in 3 workers in Australia is in low-paid, insecure, casualised work. So that means 1/3 of our workforce, 1/3 of our working population, doesn't have regular work, regular hours, or regular pay. And the Premier of Victoria acknowledged in 2020 that casual work was a significant contributing factor in Victoria's second wave, because casual workers with no sick pay and no holiday pay couldn't afford to stay at home when they had symptoms. The second wave was sparked in leaky hotel quarantine, but it was stealthily fuelled by our reliance on casual work. The state government was literally forced to introduce isolation payments so that workers could afford to stay home when they were sick. And having that basic income played a role in helping to reduce our transmission rates. But those types of payments are really only a band-aid solution. The real answer and the real response is structural change, so that all workers have paid leave, a living wage, and regular, secure work. Comrades, we'll all be at the polling booths this year. Us Victorians are going to be there twice. When we go to the polling booths, we elect a government to represent us. Representation means governing for us, the people. It means governing for fairness and justice for everyone, not just the wealthy and privileged few. Over the past 2 years, we've had a COVID-19 pandemic, a bushfire and a climate emergency, and an epidemic of violence against women. And we know that violence against women always spikes during disasters and other catastrophic events. And we know that when the economy suffers, it's always the most vulnerable workers and the most vulnerable communities who take the biggest hits. Women, Aboriginal people, older people, and casual workers. Yet what has any government from either side done to support those groups? Not sure about you, comrades, but I feel pretty let down by our elected leaders. I watched Grace Tame and Brittany Higgins speak at the National Press Club on Wednesday. 2 young women, both in their 20s and both survivors of horrific trauma. Both of those young women demonstrated strong, courageous, dignified, transparent and effective leadership on issues that we didn't even speak about publicly a decade ago. 2 young women braver, more honest, and more transparent than our elected leaders. Historically, when governments haven't represented us, we've hit the streets. We've stopped wars, we've won equal marriage, we've demanded climate change and safety for women and Aboriginal people. And when our bosses haven't paid us a fair wage and haven't given us a safe workplace, we've walked off the job. We've sat around the bargaining table, and when they don't meet us halfway, we've worked to rule, taken industrial action, and gone on strike. Some battles we've won, others are still a work in progress. And the pandemic has made hitting the streets and taking industrial action a little bit harder, but it's made hosting the tennis and the cricket a little bit harder too. But the cricket's gone ahead and the tennis has gone ahead. It's been done a little bit differently, but it's still gone ahead. It's still happened. And we've found ways to hit the streets too. Hundreds and thousands of our feet hit the streets for Black Lives Matter and for March for Justice. We did do things a little bit differently to how we usually do it, but we did do it. Mobilising on the streets is still doable. Comrades, we've never won anything without a fight. Everything that we've won, all the legal, social, industrial, and legislative wins that we've ever had, is because an ordinary person spoke out, demanded change, started a movement, went to a protest, or walked off the job. And workers are already voting with their feet and they're already walking off the job, but in a different way to what I'm talking about. Because essential workers in essential industries are resigning in droves. They've even got a name for it, the Great Resignation. Workers are tired of the low pay and the pressured work and the high COVID risk. They've had enough and they're just leaving. We've got a climate crisis, a violence against women crisis, a health crisis, and now we've got a worker crisis. And I'm not standing here before you all pretending that I've got all the answers or that I know what our next step should be, because I haven't and I don't. But what I do know is that during times of shared struggle and collective responses, the union movement has always found ways to lead us forward. As Paul said, it shouldn't be our job, it should be the government's job, but they're not doing it. And we need to find a way forward right now. We've got a unique ability for mobilising and leading large numbers of people forward through really hard and challenging times, and doing it safely and legally. As Grace Tame and Brittany Higgins said so well the other day, the time for words is gone. We want action. During the COVID-19 pandemic, ASU library workers in Geelong grew their membership, they put in strong delegate structures, they built a movement of workers around the library branches, they made strong demands on their employers, they took industrial action that included strike action, they hit the streets, and guess what? They won. It wasn't easy for them, but those workers got organised. They mobilised, they took action, and they won. And right now, in the middle of this global pandemic, the New South Wales nurses' backs are so far to the wall that they're going on strike. Nurses striking during a global pandemic, arguably the worst time in most of our living memories. Those nurses are clearly at breaking point. But you know what? They got organised and they mobilised too. I don't know if they'll win or not, but I do know that getting organised and mobilising is the very basic foundations of the structures that our union movement's built on. And we all know that history tells us really, really clearly, time and time again, is that when we do dare to struggle, we dare to win. Cheers, comrades. Thank you so much for listening.
Thanks, Adele. That was very inspiring, and hopefully it gets us all thinking about having a bit of a debate now about putting forward ideas on the way forward and the sorts of things that we can actually do to progress workers' rights in this pandemic period. What I thought I might start off by doing, first of all, is just allow about 15 minutes for people to ask questions or seek clarifications. And then I'm going to introduce a speaker from the floor who's going to put a proposal for us to actually debate. So first of all...
Thanks for joining this live stream. We're just going to broadcast the speakers and not the discussion. But if you're listening live, you can join the Zoom meeting by connecting to the Facebook event. Otherwise, thanks for joining the live stream. And if you like our work, please become a Green Left supporter. We really appreciate it. Thank you.